to kick this off and folks continue to come on in. And again, a big welcome to everybody. So grateful and glad you're all here for our Advancing Urban Health Equity Conference and celebrating our 20 years of transformative work at SUHI. I have the honor and joy to introduce Karen Teitelbaum, who we are so blessed to have as the president and CEO of Sinai Chicago, and very blessed to have here this morning. So take it away, Karen.
Okay, Julie, first of all, thank you. And I have to say, we've all been on a gazillion Zoom conferences, right, this year. And I have never seen such an exuberant chat room. I mean, I'm getting my energy just starting with all the good mornings. Really, thank you, everybody, for being here. We're so thrilled that you're here. And, you know, I was thinking about this. How many times can you say 20 years of transformative work? 20 years of work, yes. 20 years of transformative work. That's really pretty astounding and pretty humbling. And, you know, when we look at SUHI's body of work, everything from the research, scholarly works, publications, to community health workers, really before a community health worker was even a phrase. I mean, that was SUHI. And so many of you have traveled with us through this journey, and we're so glad that you're here today. It's going to be just a wonderful, wonderful day. And, you know, when we think about the innumerable contributions of SUHI to the realm of public health and health equity, it's pretty astounding and so important. And, you know, the past year with all the events that have been faced, from the disparities in COVID mortalities to, you know, racism and barriers to care, there were so many people who were saying this all came to light. And we at Sinai Chicago and SUHI were saying, what do you mean? We've been telling you this. We've been studying this. We've been addressing this. So I guess the good thing is that now we have lots of company in terms of you know, collaborating and our work, although SUHI's always been a collaborator. So really, I just want to say welcome and thank you in advance. I want to thank the SUHI team that worked so hard to put together what's going to be an amazing day for us. And I want to thank Julie, particularly, who has shepherded just really so much of the logistics through, and the entire SUHI team that contributed. So at this point, it's really my honor and my pleasure not only to work with the entire SUHI team, but to work with the president of SUHI. I'm going to turn the program over to Helen Margulis-Ernest, who is just an extraordinary leader. And those of you who know her know that I'm probably understating that. So Helen, let me say thank you and turn this over to you.
Thank you, Karen. Thank you so much for those remarks, which really got us started in the right direction today. And I want to thank all of you for joining us today as we celebrate SUHI and the work that we have done over the past 21 years, actually now, to really move the needle towards health equity. It's amazing to see how many of you I know and how many of your organizations have partnered with us on this journey. And I have every confidence that for those of you I don't know, that we are going to begin a collaboration that is going to continue to transform Chicago and move the needle in the right direction. So we had over 400 people register today. I see that many of you are already with us and hopefully the rest will join soon. But we did want to get a lay of the land. We have a really diverse group here today and we wanted to get a sense of which organizations are represented. So if you could quickly fill out this poll, it's only going to be up for a brief amount of time. Love to see who's here with us today. Okay, so we'll just wait for those results to come up. Okay, so yes, so you can see we have a really diverse group. I'm really interested to see who's in that other group, but we have about a quarter of our people are from universities, quite a few researchers, healthcare organizations, community-based organizations, and some community members as well. So thank you so much for being with us. Okay, next slide. All right, I need to start this conference by dedicating it to SUHI's founder, because as we talk very briefly right now about SUHI and who we are, at our essence and at our core, the vision and the mission that we are moving forward started with Steve Whitman. Steve Whitman joined SUHI, or came to Sinai in 2000 to found the Sinai Urban Health Institute. And he really embodied this mission of health equity. Everything he did, for those of you who were blessed to know him as I was centered on that. His whole life was centered on moving the needle towards health equity. He called out racism before anybody was calling it out as the underlying social issue that we needed to address if we were going to get to health equity. And he was my mentor, my friend, my boss for many years. And he's the reason that we are who we are today. So this conference is in his memory. All right, so who is SUHI? For those of you who have been working for us, you know that we are all about hyper-local level health and hyper-local data. We are about communities, and we are about working with communities to support communities, bring out assets within communities to support them in thriving in health. So our mission is very much grounded in health equity, has been from our inception, and working with communities to start with data and research, and to take what we learn to come up with the right solutions, to put those into practice, and to scale them as appropriate. From our inception, we were really founded because Sinai was in many ways very proactive in understanding that if we are to serve our patients well, we need to understand what's happening within the communities and within the whole life that they are living. So we really, before anybody else was talking about social determinants of health, that's what we were founded on. So this is a framework that was put out by the county health rankings, and there's other similar frameworks out there. But what really is the point here is that only 20% of health outcomes come from what happens within the four walls of a health system, from that clinical care. The other 80% are driven by all of those other things that surround us in our lives, our health behaviors, our social and economic factors, and our physical environment. And that is what SUHI has been focused on from our inception. And finally, before I introduce Dr. Maybank, I wanted to quickly take you through the Sinai model and the SUHI model in terms of how we do our work. So we are very data-driven. Dr. Whitman was a statistician, a social epidemiologist. So we, from our inception, were about starting with the data. But it wasn't about getting data that would sit on a shelf. It was about getting data that would lead to action, so actionable data. So we start with the data on a hyperlocal level whenever possible. We then disseminate our data back to those who will be able to use it. And we have dialogue, and we work with communities to better contextualize that data and understand what's really driving those health inequities that we might be seeing. And then together we prioritize health issues, and we develop initiatives that then we implement and evaluate. And when we talk about evaluation, we're talking about not only outcomes and impact, which of course is ultimately what we want, but we want to understand the process. We want to understand how we got there, so that when it comes to scaling and getting these solutions out to a wider scale, we're ready for that. And finally, you will be hearing throughout the day that we have certain core cross-cutting principles that are central to our work and that we will not waver on. And among those are leveraging and strengthening community power. It's all about starting with the community, using data to drive our decisions, acting with equity as our central lens, focusing on building that lasting capacity, really focusing on collaboration. And again, thank you to all of you who have been our collaborators and will continue to be our collaborators in this work, and emphasizing the unique histories and community assets that we have. So finally, before I turn this over to Dr. Maybank, I wanted to thank all of you once more for being here with us. I want to thank the SUHI team. You all have been extraordinary. We are a small, although we've grown 40% in the past year, so we're getting bigger, but still to pull off a conference like this, it has been a team effort. I'm so thankful to each and every one of you for giving more of yourself and for finding those hidden talents and bringing them forward in this effort. Sinai Chicago, to Karen, to Dan Regan, who runs our marketing department, thank you so much. Dr. Maybank, thank you for being here. And I want to thank all of the panelists and the guest speakers. You're all listed here. I appreciate you taking up your time and your talents to be with us today. So with no further ado, let's get to the reason most of you are probably here right now, and that is to hear Dr. Maybank's keynote address. So I will introduce Dr. Maybank. Aletha Maybank is the Chief Health Equity Officer and Group Vice President for the American Medical Association. In that role, Dr. Maybank focuses on embedding health equity across all of the work of the AMA. Prior to joining the AMA, Dr. Maybank served as the founding Deputy Commissioner for the Center for Health Equity at the New York City Department of Health and Mental Hygiene. She holds a BA from Johns Hopkins University, an MD from Temple University School of Medicine, and an MPH from Columbia University Mailman School of Public Health. So with no further ado, welcome Dr. Maybank.
Thank you, everyone, and a pleasure to be here. I'm just going to put my share screen on, put this up. It's ready. Right. You all can see my screen. Perfect. All right, so awesome to be here this morning with you and SUHI. I've heard much about you over the last year and a half, and the organization and the great leaders within the organization as well that you all have been doing to advance equity. From my colleague Fernando De Mayo, who is on the Center for Health Equity's team and serves as our Director of Health Equity Research, but also is still full professor over at DePaul Sociology. So just honored to be in this space with you and that you have asked me to join you. I just first want to make sure, again, I think an important part of operationalizing racial justice, and I think that is the work and the language that we have to do moving forward, is just, again, centering the voices of those who have been most marginalized and their histories as well, of those who have been most marginalized. And I know a lot of the work of SUHI, I just saw in your model, definitely is very intentional about integrating those voices into the work that you do. But this is a land acknowledgement for our Indigenous brothers and sisters whose lands have been stolen over the years. Right now I'm sitting in New York City on the land of the Lenape. And I also want to acknowledge the extraction of brilliance and energy and labor of people who were forced here from the continent of Africa, and to celebrate the resilience and strength of all of our descendants and recognize that we still carry our ancestors with us. And I very much kind of harbor that in the work that I do, and recognize I would not be here for all the doors that my ancestors have opened for me to be here. So congratulations in celebrating 20 years. My birthday's next week. I'm not 20 years old, but I know it's a big deal whenever we have a birthday, and it's just important to celebrate and acknowledge kind of our resilience through. I'm sure there were times that were hard and not always smooth and easy, and figuring out what direction you want to go, but you are still here and you are relevant. And I want to just, acknowledge all the work that you've done that I think pushes the envelope as it relates to being engaged. Again, I mentioned earlier about centering with other and marginalized voices, but also being informed by history, challenging narratives, making sure that the focus is not just on the identities of people, but the systems and structures of power that actually impact people's lives. And then the importance of working with others and in solidarity with others as well. So congratulations to all the work that you do, and we're honored to be in partnership with you this past year, especially, but also just in moving forward. And we've worked very closely, especially through Fernando, on the racial equity response team and with the Westside United efforts, as well as an awesome publication that's to be out called Unequal Cities by Maureen Benjamins and Fernando De Mayo. So very much looking forward to all of the work that we can do together moving forward. As a center, we're about to celebrate I guess we are celebrating our 2-year anniversary this month. Is when I started 2 years ago at the American Medical Association. And we've spent some time really getting to know and figure out what our strategic direction is going to be. And it's been formed by many different opportunities. One, our personal experience that the team brings forward, our professional experience, of course, where the space of equity and justice is moving forward to, and then just hearing from many different stakeholders across the country, We're going to be releasing the full strategic plan by the end of the month. Fingers crossed, everything goes well. But we're very much anticipating and looking forward to being able to share, some of the work and the direction we want to go with the AMA. And I'm going to talk about some of these in a little bit more detail, but embedding equity, building alliances, and sharing power, ensuring equitable opportunities and innovation, pushing upstream, and creating pathways for truth, reconciliation, and healing. And so, in the embedding aspects of the work, I think this is an important kind of theory of change, that we can't do the work outside of our organization if we don't first look inside of our organization. So it's the inside outside strategy. So we as AMA, we have a management team of 1,100 folks, and we execute on the policies that our membership pass. And it's important that if we're executing on policy, then our team members and staff need to understand, what do these definitions, what do these words and concepts mean? How do they impact how they view the world, and how they create action and decisions within the world as well, and also within their work. And so they need to be able to challenge their own mental models that they show up with on a day-to-day basis at work. So there's lots of intentional work to look internally to help support our teams, build an analysis and a shared analysis to be able to talk about and converse on these issues with not only amongst themselves as teams, but with people outside of the organization. There's work to kind of organize and kind of create an accountability infrastructure so that we actually do what we say we're going to do. And then if we don't, what are we going to do in those instances? And then there's the opportunity to kind of operationalize, provide tools for people as well. And we're working with several national organizations to help support that. And we have a team. I think also critical to this work as we do it internally is to recognize the opportunity that can happen to traumatize and re-traumatize people as we're starting to kind of create these spaces in which we're having conversations which we've never had before. So we want to make sure we have an integrated kind of trauma-informed lens and approach to the work we do. And I think this is not just for internal work, this is for external work as well. This often gets left off the table. And I think it's critically important to have. And then over time, we're going to, share and assess the change and the impact of that change in the work that we're doing. I think this is probably very kind of obvious and familiar to many of you, the ability to build alliances and to share our power in different ways, and really centering the voices. For us, we're a physician organization as AMA, and it's important that we're really centering the voices of physicians and of color, and also other marginalized physicians, and understanding what's their experience during this time, especially in this last year, but just in general, what has been happening. Many folks know AMA, and if you don't know, explicitly and intentionally excluded Black physicians from joining the AMA, and really that policy did not change until the 1960s. So that has tremendous impacts in many different ways, which I'll come back to. And I think we're going to work more definitely to build established types of coalitions. This is a broad kind of term, but ways in which we can work in better solidarity with others, but especially also bringing together healthcare and public health. I come from public health. I love public health. And now being in more the healthcare side, definitely seeing the gaps and the differences between the two sectors even more so, but the opportunity and the need to bring them more closely together. And there are many ways to help support doing that. One of them is by working to push upstream and the narrative to address all determinants of health and the root causes. So working to strengthen physicians' knowledge on just public health overall and the drivers of health inequities. And we'll use several of our kind of assets and vehicles to do that. And this isn't just physicians that are already finished, but also med students. So what's happening in medical education? What's happening in continuing medical education? And then what is the work of the kind of health system at the healthcare system level, even the public health system level? What are they doing to work to dismantle structural racism and other systems of oppression? How are they interacting with communities? And you all are very well aware of the opportunities as it relates to that, but it's not something that from the healthcare lens and the healthcare system that is, I think, well known and well done, and many folks aren't really participating and leading in many opportunities to engage with community health and public health and see it all as one opportunity and ecosystem to improve and impact health. So how can we spur and inspire that thinking? But that means there's going to have to be some changes as it relates to some of the infrastructure that exists and the structures that exist that actually undermine our ability to advance equity. So there's going to have to be advocacy in different ways, but how can we also encourage physicians and healthcare systems to be a part of that advocacy to change these structures over time is important to the work. In the healthcare space, which is a little different to me than in the public health space, is this context of innovation. I think innovation is a very broad term that can mean many different things to many different people. In the space of healthcare, it's usually aligned with tech somehow or another. And what we're realizing is that, and many folks know this, is that there's just tremendous amounts of exclusion in the innovation. Who gets to decide what's innovative, who gets funded for innovation, who is funding innovation. It's very exclusive, predominantly white men, and that the data shows that quite clearly. And so what can we do as the AMA to, one, just evolve how we are in the space of healthcare innovation and influencing that space? And then also, how can we influence this space itself in the sector of healthcare innovation? And so, we are working very intentionally in figuring out how to do that. This is one of the ones that is at the very beginning phase. But we have an advisory committee that's pretty awesome, from representatives from across the country who are at the intersection of equity and justice and innovation, kind of informing us and guiding us on our direction and how to do this best. And then our last strategic approach is around fostering pathways for truth, reconciliation, and healing and transformation in AMA's past. And all the work that I mentioned before is under the umbrella of kind of the truth, racial healing and transformation, but the reconciliation and the redress parts of it are what we need to be a lot more intentional about. What are we doing to actually repair and right the wrongs of the past? Many may know that we did in 2008 issue an apology, Ron Davis, to the National Medical Association that was created because AMA excluded Black physicians. And in that apology, Ron Davis, who's the president, said we need to right the wrongs of the past. And that apology was the first step in doing that. But there was much more work that we were going to need to do. And not only for the context of Black physicians, but for other physicians potentially, and the communities that they're serving, because that impacted beyond just the physician themselves. And so, we have to think very intentionally and plan on how are we going to repair these wrongs. It's a vital part of healing, and I think it's a vital part of the work of advancing equity. Most institutions in this country that are historically white, predominantly white-led, have some level of interaction with the neighborhoods, oftentimes, not all, but the majority, that have not been great and have been harmful. And so I feel we as institutions need to be comfortable to step into that space and to name it, to own it, to understand what those impacts are from a qualitative perspective and a quantitative perspective, and then figure out what are we going to do to repair that harm. And so that means, and this is just another slide that's kind of outlining some of the harms that we have done. And I mentioned already the exclusion of Black physicians, but also the Flexner Report of 1910, which tremendously revolutionized medical education at that time, was commissioned by our AMA's Council of Medical Education. And one of the recommendations of the report was to close 5 of the 7 Black med schools and all of the 3 women's schools. And so, affirmative action has helped parity for women in med school, but it has not helped Blacks in med school. And so we still see tremendous lack of diversity, and this Flexner report definitely has contributions to that. So what are we going to do as the AMA? How do we reconcile that history, and how do we repair that history as well? And the studies are starting to elevate about, what would be the estimates of the African-American medical graduates if these schools, had not closed. And this is a paper that was published by Njama Open Network. And then we even have our history of our former AMA president, J. Marion Sims, whose history was very much elevated in Harriet Washington's book, Medical Apartheid, which I'm sure many of you are familiar with, in which he performed procedures and experimentation for the sake of innovation on the bodies of enslaved Black women, oftentimes and most times without anesthesia. And, you know, he became actually AMA president after that history and after those realities. So again, what do we do with that history? What we have done recently, our CEO, James Madera, read some of the pieces, and this is why history and documenting history is really important, and archiving history is really critical as well, because there's some pieces that were written jointly between the NMA and AMA in like around 2006, 2005, that in great detail talked about and laid out the decisions and the decision-making process as best as they could figure it out of the exclusion of Black physicians from the AMA. And after Jim Madera read those pieces, he on his own immediately asked for the bust and kind of the exhibit of Nathan Davis that was on the 46th floor of the headquarters of AMA. I haven't been there in a while because we're all working from home, but from the headquarters of AMA, and asked for it to be moved to the archives. And that there was really no place for it in the archives, but no place for it on the floor, because recognizing the harm that it causes people and the harm that it's caused, you know, the Black physician as well as the Black community, and that it would be go to the archives as an educational piece. Also, the AMA at that same time, the board removed and stripped the name of Nathan Davis from an award that annual award that we had in his name. So, you know, this was just in 2021 in February, and it's just one small step, but it is a step, and those are the kind of actions that we have to move forward. I think, you know, for me in doing this work, I am evolving. You know, this year in COVID, there's been a lot of, you know, I saw this slide, I think, a few months ago, and it struck me, you know, they were talking about kind of digital transformation is years away, and they don't see how our company is going to have time to change, you know, anytime soon. And for me, as I was saying, like, I'm evolving, and I think many of us are evolving because the realities of what COVID has brought up. And in the beginning of the conversation, you know, it was highlighted that, you know, many of us have been in this space, working in the space of equity. We knew they existed. We've been trying to shout from the mountaintop that they're here. You at SUHI, we have been doing that as well. But but a lot of folks weren't listening in terms of big decision makers around, you know, the distribution of resources, et cetera. And so now we're in this time of COVID, exposure of inequities. We weren't talking about racism. Now folks are talking about racism in a way that they haven't before. We see it named. And then I think also I elevate, and now everybody understands the case that is being, that is on TV now, not just on TV, but that is happening and being aired on television. The impact of the public murder of George Floyd was, I think, pretty tremendous for many of us in the country. But we know that one, these murders, police brutality have been happening for centuries. And after George Floyd, they didn't stop. And so we see the lives of Dante Wright and many others that are impacted by structural racism that still exists in this country. And then even the story of Dr. Susan Moore, who was a physician who passed away from COVID, also at the hands of structural racism. So, you know, these things are here where people are talking about them in a way that we haven't before. We have cities across the country putting forward, declaring, you know, statements and pledges that racism is a public health threat. This is from APHA. They have this on their website. They're collecting who is doing this across the country, which jurisdictions have done this. At the time I pulled this, which was I think about last week, there were 190. And so this is great movement. Naming is absolutely critical. And it's interesting because so now we have naming, and it's kind of the question is now what? We have, you know, even us as AMA, you know, over the summer when the public murder of George Floyd happened, we released a pledge, the Board of Trustees, And then the follow-up to that was actually a formal policy that was passed in AMA on naming racism as a public health threat, ridding our healthcare system of racial essentialism, and supporting the elimination of race as a proxy for ancestry and genetics. These are big moves for an organization and institution such as AMA that is very well known to be probably, contributors to scientific racism within our country. The other thing just to point out is, I have talked about, declarative statements that have been made, the importance of doing that, but how do we move beyond that? How do we move beyond anti-racist praxis? I just read this article within the last 2 days on Medicine for the People, asking the question, what are the ethical and political paradigms that can take us beyond righteous rhetoric and make changes in material conditions for the most marginalized? I think that's the question we have to keep asking ourselves. What are we going to do differently? I look at Kamar Jones, and she talks about, I talked earlier about kind of the technical pieces of doing this work, but the technical pieces won't be enough. I've learned in doing this work. We have to get even dig deeper than beyond just even anti-racism and naming anti-racism, and start naming white supremacist ideology, the false notion of hierarchy of human value based on skin color, with white being on top. I forgot the white part, but being on top. That's, I think, the next area we have to go. And now with the incident of JAMA that many folks are aware of for AMA, I'm evolving and put, myself even further. And I feel we need to start talking about even the deeper roots of white supremacy, because white supremacy is kind of the umbrella oppression and patriarchy for all of the other oppressions that really exist. And I'm learning how exhausting intimately having to respond to racism and white supremacist ideology is, and not for myself, but community has been exhausted for centuries. And so this is the American Journal of Ethics. They published this just this last month, and they're starting to change their frames or evolve their frames, I should say. They'll highlight racism, but understanding that white supremacy is the fuel for racism. And so we have to be able to name that as well. I wish the American Journal of Ethics, the American Medical Association Journal of Ethics, got the same attention of JAMA, but they put out excellent information and material that is really at the front line of equity. And so when we think about our roles, and this is kind of where I'm challenged in thinking about my roles, we know we have to name and call out white supremacy and racism and other ideologies. I think also really critical, and I think you all are definitely embarking on this, is making visible not just merely the descriptive inequities, but also, again, how do these systems and ideologies really cause harm and work to concentrate power? Power is often left out of the conversation as well. How do they concentrate power and wealth within our institutions and away from neighborhoods and communities? And honestly, most of our institutions are set up to do that, and we need to talk more directly about it. And then the question is, then what? So we make it visible, but then what? Because what I've come across and come up against is I'm still not the ultimate decision maker. There are other folks who are at the head of the institution that oftentimes in the institutions that I've worked in are predominantly white and are predominantly men. And what do we do? And how do we change, and how do we get people in power to do differently, to show up differently, to move beyond their own self-interest experiences and to really care? And I get people will care. It's not that people don't care, but how do you really care about these issues deeply? And I don't have the full answers to that. I think we have some strategies around that. The Surgeon General, the former Surgeon General, now at this time in his life is talking lots more about we need leaders who care enough, who know enough, will do enough, will persist enough in the efforts. As we know, it's important to center and integrate the voices and ideas of those most marginalized, but there's some level, there's something a little off even that, because there's a burden to me that's placed on people by doing that, because we're not talking about what the power is around that. Brian Stevenson talks about getting proximate to the people who are suffering. Does that help people care more? And I think it does. I'm not saying any of these are not important, that we shouldn't do these. I think they are. But what I'm saying is that I'm not sure it's enough. And then in the piece that I mentioned earlier about medicine for people, there was suggestions about, that doctors need to, really be close and really be in communities. with those who are most marginalized to really understand how structural oppression really lives out on a day-to-day basis. And, as I end here, or start my close, my point in saying some of this is, and it's kind of where I'm at in my career right now and in my daily conversation of just, where do I go from here? Where do I go when we're in institutions that are still so powerful and still have so much power over the day-to-day decisions that people make, that still maybe not at the full point of advancing equity in the way and justice in the way that our communities absolutely need. And, am I in the right place? Are we, am I talking to the right people? Am I saying the right words? And I caution to make sure that this work is just not the work of Black and Brown people in this country and those who are most marginalized. I always caution against also the language of allyship. I'm looking for co-conspirators, accomplices, people are going to be, rolling up their sleeves and learning and digging deep and building that analysis along with me so that we can name the structures, can make them more visible, work better in solidarity. This I read this morning. I happened to read this morning. It was on my Twitter feed. I love Twitter because you get access to so much information. But I thought it was a wonderful piece by Hani Kim on the implicit ideology function of global health. She's talking about global health, but it applies to everywhere and its role in maintaining relationships of power. And, she in it, and I put this quote in, and it's long, but I think it's important, that the point is, recognizing not only kind of the structure and power and balance of the institution, but also my own contribution to it as well. And just making sure that we don't have false illusions around what we think we're really doing when we're not really doing that, what we think we're doing. And how do we make sure that, again, is that we're working together to make these structures of injustice visible. We're naming them, we're recognizing our own contribution potentially, but we're also working in solidarity with one another. And if we don't name the things that are often invisible, it's really hard for us to connect those dots. And that's where the courage part, I think, really steps in. That's where the hard part, I think, for many people who are leading this work, whether Black or brown or white. And it's only at that point can we reimagine a future for racial justice that is different. And so as you all are kind of moving forward, at this 20th year of your work, I fully hear it that, you have been engaged in work of ending inequities and disparities. But what do we need to do differently, at this point in time, at this moment in time, than we've done before? I think it's a critical question for all of us at this moment. I call upon Ida B. Wells. I used to have James Baldwin. I changed him out today because my spirit is feeling Ida B. Something about her leadership in the anti-lynching movement and all that she's doing, all that she did really resonates with me. And more so because at this point in my career and all the questions that I asked before about, why am I here? What am I to be here? Should I be somewhere else? Is this the right work to do? I just think about like what gives me hope, and kind of sustainability and sustenance, to continue forward is just the realization that I'm part of a legacy of, fighters and healers, people who open doors, and, people who just want to be free and liberated. And so I feel a strong sense of obligation and responsibility to that legacy. And I know it's all allowed me to sit here today, but I for all the folks who are Black and brown, who are listening in, I understand the moments of that you feel. I understand the moment of time and the reckoning that this country is going through. I understand the exhaustion of it all. And I just want you all to know that I see you and I hear you, I feel you. And because I think that's what we need oftentimes when we're doing this work, to kind of propel us forward and for folks to see and understand and shed a light on things that they may have never known or understood before. So I thank you all for the time for today. And again, look forward to working with you more. Thank you.
Thank you, Dr. Maybank, for that authentic, powerful. Kim put in the chat, wow, just thank you so much for starting us off with those words and that inspiring keynote, which also, goes really well into thinking about where we're going next, which is exactly what we want to talk about today. So how can we take where we are right now in this moment in time and build upon the foundation that's been built to really accelerate things and to get to where we need to get immediately, as fast as possible. So thank you for that.